Today's guest is Brian Masse, the MP from Windsor West. Welcome, Brian.
Thanks for having me, Robert.
How are you and your family doing during this pandemic?
Thank you for asking. We're fine. We're blessed to be able to be in touch and to be as a family unit mostly together. My son is at home. He goes to Walkerville School, so he's had to adapt like everybody else. And then my daughter is in Halifax at university, but she's in a good place, a safe place, and is doing well with her studies despite the challenges. So thank you for asking. It's appreciated.
Yeah. How has COVID-19 affected you and your constituency office?
Well, it's really changed. I've taken a lot of pride over the years. My background is as a social worker. I used to work on behalf of persons with disabilities and New Canadians, and I've always been proud of being able to serve basically the street front atmosphere that we have are on Aletta Avenue here, and we've had to close because it just hasn't been a place conducive to the public, and then as well too with the restrictions to do the social distancing and everything. So it's been hard for us because we really enjoy that interaction. And so we've had to move to online, we've had to move to more email, we've had to move to more social media. Those are things that we're very busy at. So that's been the constituency front to it. For myself as a member of Parliament, I haven't been traveling to Ottawa. I've participated in the virtual meetings, and also my committee, though, has also been meeting. And just this past week, I actually had a motion, the first motion passed in Canadian history virtually, with a recorded vote at committee. So we've been kind of doing those things to stay busy. So the big thing, though, the constituency is that we really enjoy the work here and the connection, which we try to find other ways to stay together and doing the things that are important for Windsor West residents. That's been a real challenge.
Being a border city, what are your thoughts about opening the border and our economy?
Yeah, that's a great question. And just yesterday, I wrote the Minister of Public Safety about this in terms of creating a process for families to reunite. So first and foremost is that we have to stay safe. And so I have been strongly supporting the border restrictions because with the United States and Detroit and the complications there, we already have a lot of exposure. And I want to thank the health people, everything from the nurses to the public sector people providing the supports. PSWs like myself, I'm a PSW, who have been helping, and many of them actually have been crossing into Detroit as well. And they're very careful and cautious when coming back and going through a whole rigorous process. But we can't have regular travel right now. But at the same time, there's a lot of families now. It's been almost 2 months of basically closure, and they can't see their loved ones. They have dependents with regards to children. We have married couples. We have people that have with disabilities that we're getting, all those different things. And so I've asked for an exception process to at least be applied to so that you can actually go forward. So what it would mean is that you would actually have a process to go through. And then more importantly, would be based on 2 factors. The first and foremost is making sure you have a plan in place and you could do so safely and accountability. And then the second part of that would be for these family reunifications and exception application process. So until we have further strength of this virus, we can't just open it up again. But in the meantime, we need to have a plan for families to be able to actually have a potential to reunite, or at least a process for the exceptions where it's appropriate and where it's safe.
Do you see any timeline on that, Brian, when that might be passed?
I don't know. I mean, it's getting to be a very significant issue. The government actually has said that they've discussed some things with the provinces, but it really is federal jurisdiction at the end of the day. I'm hoping they'll come forward with a plan right now, right away. So I've made a proposal to them. I'm open to other proposals. We've based ours upon the current immigration situation now, where if there's an exceptional case, the minister does a review. So we've asked that because right now you have no hope and you have no sight in what could things be next month or the following month. And that's not appropriate either. So we need to have a triage process to deal with these situations. We've had pregnancies, we've had people that are married to a doctor or married to somebody else, or even just a manufacturer, just like the common families back and forth. And what we're saying is that there should be at least a review process, because people, if they can prove that you're going to follow the health unit process, and you can do the self-isolation, the self-quarantine, and follow all the rules to the letter of the law, and you have that plan in place, and then you have a significant reason to do so, then there should be that type of an appeal process. We're all adults here. We want to build an accountability, but we need to have some hope and opportunity for people to reunite, because there are those cases out there that do need to be reviewed.
Yeah. What are your thoughts on the government's economic plans and initiatives so far?
Well, it's been actually an interesting situation, and we've been supporting a lot of the government's initiatives and actually changing them. As New Democrats, we've changed a whole series of things that have been laid out in the past. And what we've been doing is trying to focus the results on people. And that's been very positive in many respects, because people need to have rent payments, they need to be able to get their medications. With the closure of businesses, they have to have income. As New Democrats, we wanted a universal assistance program. The government's decided to do several different variations. So there's one for workers, there's one for seniors, there's one for persons with disabilities, there's one for a series of different things, which have created complications and challenges. But we've been able to amend those with the government. I think a minority parliament's been the strength of how we've been able to deal with this, because it's led to some flexibility and some second thoughts. So, but we still have to work on some issues with the government. First of all, we don't agree with them giving companies money when you actually have offshore accounts and you have been caught for actually not paying your Canadian taxes. And then also too, there's local issues here where workers got an unemployment assistance benefit called the sub. It's an additional money that's been bargained at the collective agreement, where the government right now won't let them collect that without penalty. And so we're trying to change that, because it's not only just affecting Windsor, but workers across the country. So there's been a number of positives, and then there's also challenges, and that's just the way it works. But as a New Democrat, we've been proposing changes. The most recently one we're supposed to get very soon is some assistance for persons with disabilities, because they've received nothing from the federal government right now. We're told that has been gone to cabinet and it should be released very soon. So that's what we've been trying to do, is negotiate some of these improvements.
COVID-19 has spread throughout many of the long-term care facilities. What needs to be done to protect our seniors moving forward?
Well, this is a disgrace. Who could imagine that in a country like Canada, we need the military to come into some of these institutions to take care of the basic needs of individuals, and it should reflect poorly on all of us, and we need to do better for it. I'm of the position as a PSW, I've seen some of the things in the past where it's been questionable in terms of the practices, that profit has been the champion of the day versus that of actually the care of our seniors. And we really all need to come to grips with what's taking place. It's no accident that deaths are occurring in these facilities, and we should reflect on that to do better. So I believe this should be in the Canada Health Act, and we should actually have the federal government to be providing some type of guidance and assistance to provinces. We've gone from a 50% copay in our healthcare system to the provinces to about 20%. So we're actually, transfers to the provinces have gone down, and that's a problem in itself. But we need to have some minimal standards with regards to the healthcare persons, and why we have to make profit off of our seniors in their golden age as opposed to quality of service makes no sense whatsoever. So that needs to be wrestled with. Public inquiry is necessary. And then lastly, we need to have follow-up on this, because simply we have to do better. Who in this day and age would have to say that we have to rely upon our military? We normally send our military to other countries to take care of people. We have to send our military to take care of people in Ontario. We need a good, strong look in the mirror about what that means for ourselves and what that says about our prioritization of our seniors.
Lastly, can you provide an update on the Ojibwe Shores or on the National Urban Park for Windsor and Essex County?
Yeah, thank you. And this is part of what we need to do here, and is that there are, despite the challenges we have with right now going on, many opportunities to go positive and forward. And I would suggest even the last topic, how sensitive it is with regards to our healthcare and our long-term care, there's opportunity to learn out of that. And similar to with Ojibwe Shores, there's an opportunity for us to build next to the new Gordie Howe Bridge at National Urban Park. So the update with regards to that is that the shoreline is a little bit unstable with regards to the high water. So we're pushing for the land to be transferred from the federal government one department to a next, so we don't have our local taxpayers paying for it twice. I've been happy to report that the Ministry of Environment is looking again at this. Right now the port has the property, but there's over 110 endangered species there, and it's become internationally known as a hot spot in terms of the type of species which are important for not only just North America, but for the world. So it's amazing, because this is becoming more renowned across not just Windsor, Essex, but also the country, and we're getting other organizations. So there'll be more happening, but the good, real positive news over there is the vision for a national urban park, I think, is starting to crystallize, which would be amazing if we open up the Gordie Howe Bridge with a new national urban park next to it. We really showcase this area. Imagine our own Point Healy right here in the city of Windsor.
Mm-hmm. Brian, we're at the end. We always try to look forward to some hope. What are you looking forward to when the pandemic is over?
Well, I think that we, like a lot of things in Canada, when we've had these challenges, we've led forward with changes that have been significant. And so what I'm looking forward to is a better Canada. I think that there's no doubt that we're all challenged in many ways about this, but that's how we've borne our healthcare system, which is serving us now. This is what's created our employment insurance, our Canada Pension Plan. They came from moments of crisis, of understanding that as a society, we have to do better and we can do better. So those are the things that I'm looking forward to. I look at a green economy. I look at the opportunity for reinvestment in the manufacturing sector. I look at a better response for our healthcare, for prescription drugs, for like pharmacare, and also our healthcare for our seniors. These are all the things that we can learn from this. So I know that it's a tough time for everybody right now, and including all our first-time responders and our supply chain workers, who I'm so grateful and proud of during this process, and thankful for them every single day. We owe it to them to do better, and I think we can, and I know we can. So from this, in my perspective, is to keep digging in with regards to a better hope and opportunity for our future, and we can do that. That's in our control. That's in our capabilities. So for me, it's about making a better, stronger Windsor, Essex, and Canada.
Terrific. Well, Brian, we really appreciate you taking your time to join us today. Please, thank you, and stay safe and stay well.
Thank you, and I want to just at the end say thank you also to Cogeco for part of the telco sector is providing additional services and supports for Canadians, and it's important to recognize that was a gift and an important contribution. I want to say thank you for that as well too.
Thanks, Brian. That was Brian Masse, MP, Windsor West.